Oh hey, you're up. I prepared breakfast for us and I can't wait for our appointment for today at 10 a.m.
Right? It's today, so we should probably get ready.
Hello, good morning. I'm Marmelan Padolian, your nurse for today. How may I help you?
We are here for our prenatal checkup.
Okay, may I have the prenatal monitoring sheet, please?
Here.
Thank you, ma'am and sir. Please take a seat.
Thank you.
Okay, ma'am, for verification purposes, may I know your full name and the date of birth, please?
My name is Christine Gulang Apa. My birthday is February 20, 1995.
Thank you, ma'am. How would you like me to call you?
Christine. Just call me Christine.
Thank you, ma'am Christine. So, before we begin with the assessment, I have some few questions for you. Is that okay?
Okay, sure.
So, do you have cough, colds, or sore throat?
None?
Did you experience having stomach ache or bowel problems?
No.
Have you experienced painful urination?
No.
Okay, so is there vaginal bleeding?
No.
Okay, so how do you feel about your pregnancy now that you're already in the 3rd trimester?
I'm actually feeling nervous but excited as well. We can't wait to finally see our baby.
Okay, I guess nervousness and excitement always go together in terms of pregnancy and giving birth. But have you recently experienced anxiety attacks?
No, Nurse Remy, I haven't experienced those.
Okay, do you have any current symptoms or discomforts?
I may feel a bit nauseous every morning, but it isn't that bad. Not much of changes after it all since I've been really quite healthy. Thanks to my husband who always there to prepare a pregnant woman's need.
Wow, that's good to hear, Ma'am Christine. Thank you so much for answering the questions. You may proceed this way so that Nurse Joy can assess you.
Good morning, Mr. and Mrs. Apa. So I'm Nurse Mary and with me is Nurse Irene. So today we're going to assess for the prenatal checkup. Is that okay with you?
Yes, ma'am.
So we will be assessing your vital signs and weight, and also we would like to examine you physically. Is that okay?
Yes, ma'am.
Please allow me to take the vital signs, Mrs. Apa.
Yes, ma'am.
So your BP na it's 110/70. So that's okay. So 37.1.
Mrs. Apa, please step on the weighing scale. So, Mrs. Apa, your weight is 68 kilograms, and based on your monitoring sheet, you gained around 16 pounds in total from the 1st trimester up to the 7th month of your pregnancy, which is within the normal range for a pregnant woman reaching the 3rd trimester. So mom, let's check your height. Can you come over here?
Okay now, Mrs. Apa, to proceed with further assessment, please follow me for the physical examination room so we could have privacy. And your husband can stay here for a while.
Thank you.
Mrs. Apa, this is Nurse S. And she will be conducting the physical examination.
Okay. Good morning, Ma'am Christine. You can call me Nurse Bess. I will be conducting a brief physical head-to-toe examination. So this procedure involves the exposure of the areas to be assessed, such as the abdomen. You can help by cooperating and relaxing so that the procedure goes smoothly. Is that okay?
Okay.
Okay, Ma'am, Mrs. Apa. So please put on this gown and please empty your bladder. I'll be back after a minute or two.
Okay, thank you.
Okay, let's start. Okay, Ma'am Christine, please open your mouth. Mrs. Apa, based on the physical assessment that we did, there are no significant findings because the results are normal. Now, to validate your age of gestation, Nurse Alexandra will be here to obtain your fundal height measurement. Please wait for a while.
Okay, thank you.
Good day, Mrs. Apa. I am Nurse Alex. So, according to your recorded data, you are now already at your 28 weeks of gestation, and also your estimated date of delivery will be on the 15th of January 2022. So, this has been calculated using the Nichols rule based on your previous visits. So now that you're on your 7th month of your 3rd trimester, let me take your fundal height measurement to validate your gestation age.
Okay.
But before anything else, I would just like to ask if have you already emptied your bladder?
Yes, ma'am. I went to pee before coming in.
Great! I'll be taking these procedures on an empty bladder to avoid inaccuracy of the tests. And don't worry, this wouldn't take too long, Mrs. Apa. Also, this procedure is done to help us identify the fetal growth and fetal development, which is an approximate measurement.
Okay, thank you.
Now, Mrs. Apa, let's have you lying down in a dorsal recumbent position and kindly spread your knees. So, also, can you please lift your upper back? Now, Mrs. Apa, I would like you to relax in order to aid the procedure.
Okay.
Thank you very much.
Thank you.
Now, Mrs. Apa, I will be pulling down your blanket and pulling up your gown. This will expose your abdomen. Will that be okay?
Okay.
Okay, thank you. So now, Mrs. Apa, I'll be obtaining your fundal height measurement. So I will be using my tape measure. So I will start by your upper part of your symphysis pubis to the fundus. Now, Mrs. Apa, this week, the height of your fundus uteri is 28 centimeters or 4 fingers above your navel. So that will correspond to 28 weeks of gestation. So there are no significant findings, and based on the procedure that we did, your baby's growth and development are normal.
Okay, thank you.
You're welcome. Now, Mrs. Apa, to further validate your gestational age, here is Nurse Joanna to explain to you the estimates in pregnancy.
Okay, thank you.
Good day, Mrs. Apa. I'm Nurse Joanna and I will help you understand your estimated delivery date and will help you further understand your gestational age. So, Mrs. Apa, based on your first visit, I would just like to verify that your expected date of delivery will be on January 15th of next year, which we calculated using the Nagil's rule and date of quickening during your previous prenatal visits.
Yes, I already know that. Thank you.
So, Mrs. Apa, to put it simply, your baby is expected to be born on January 15 of the next year. Please take note that this is not 100% accurate because this is just an estimate.
Thank you so much for the information, Nurse Joanna.
Thank you so much for listening, Mrs. Apa. Please stay here because Nurse Desiree will now be assessing the baby using the Leopard's maneuver.
Hello, Mrs. Apa. My name is Nurse Desiree and I'm here to perform the Leopold's maneuver to assess your baby. Please lie down for this procedure and I'll be placing my hands on your stomach to figure out the position of your baby. Is that okay?
Okay, ma'am.
Alright, let's do it. But first, I'll be placing this towel underneath you. Next, I'll be exposing your abdomen. Is that okay?
Okay.
Okay, Mrs. Apa, I'll begin with the first maneuver. I'll be placing my hands on your belly. Is that okay?
Okay.
Okay, so Mrs. Apa, your baby is almost at a cephalic position since it is soft and immovable. It means head first position, and what I felt first was your baby's butt.
Oh, I see.
Next, for the second maneuver or umbilical grip, allow me to palpate the sides of your uterus. Is that okay?
Yes.
I can feel your baby's back on this side. It feels flat and firm. On the other side, I can feel your baby's extremities, which have angular nodulations, and it's tiny.
Oh, that's so adorable.
Next, for the third maneuver or Pollock's grip, I'll be placing my hand on your symphysis pubis. Is that okay?
Yes.
This actually allows me to determine if your baby is engaged or not. Since it is still movable, your baby is not yet fully engaged, which is normal at around 28 weeks of gestation.
Oh, I see.
Okay, Mrs. Apa, for the fourth maneuver or pelvic grip, I'll be facing your feet and away from you. Is that okay?
Okay.
This is to determine cephalic prominence. So, Mrs. Apa, we are done with the procedure, so I will just cover you back up.
Thank you.
Alright, great. Mrs. Apa, your baby shows a great attitude. Now please wait for Nurse Jean to check your fetal heart rate of your baby.
Hello, Ma'am Christine. I am Nurse Jean. I'm here to listen your fetal heart tone. Please remain lying down during the procedure for accurate auscultation. The fetal heart rate of your baby is 150 beats per minute. This is very normal since the average fetal heart rate is between 110 to 160 beats per minute. Thank you so much, Mrs. Apa, for your cooperation. Please proceed to the session room for health teachings. Okay?
Thank you.
Hello, Mrs. and Mr. Apa. Welcome to our health teaching sessions. By the way, I'm Nurse Mary. I'm Nurse Stephanie. I'm Nurse Ranlin. And I'm Nurse Brian. Please have a seat.
Thank you.
I have heard, Mrs. Apa, that you are now in your 28th week of gestation. So today we are here in front of you to do health teachings. So first is about your nutrition. So Mrs. Apa, you should take 300 calories per day. This can be achieved by eating caloric foods such as sweet potatoes, rice, and oatmeals. But remember to limit the calorie intake.
What if my wife fails to meet that calorie requirement?
So failure to meet caloric requirements can lead to ketosis as fat, and protein are used for energy. Ketosis has been associated with fetal damage.
But how about taking vitamins? Is it also important? What kind of vitamins should I take?
Yes, of course. You must take vitamin E, thiamine, riboflavin, pyridoxine, vitamin B12, and niacin. You must also remember that, Mrs. Apa, you should have low intake of salt and carbohydrates to prevent eclampsia and high blood pressure.
Thank you so much, Nurse Renalyn, but I have something in my mind that I'm very curious about. I'm too shy to ask, by the way.
Mr. and Mrs. Apa, in the final months of pregnancy, you might worry more that sex could harm your baby. But your baby is well protected and sealed off in this amniotic sac, so you can't hurt your baby by having sex. If there are no problems with pregnancy and you and your husband are keen, then sex is fine in the final month. But you must follow the principles of sex during pregnancy.
What are those principles?
So when having sex during pregnancy, it should be done in moderation and in a private place. The woman must be placed in a comfortable position, like doing the side-to-side position of having sex. Avoid blowing air into vulva on your wife, and both of you must always put in mind to avoid having sex in 6 weeks prior to estimated due date.
Thank you so much for the advice, Nurse Stephanie. But my appetite in doing sexual activity today have lessened. It's not like in my second trimester, where I crave to do it.
Yes, you are right. During first and third trimester of pregnancy, your sexual appetite is lesser than in second trimester of pregnancy. That is just normal.
How about doing exercises? What kind of exercise can my wife do during her third trimester?
Mrs. Apa can do light exercise like walking since it is the best form of exercise, squatting to strengthen her perineum, Kegels exercise, abdominal exercise, shoulder circling exercise to strengthen muscle of the chest, and pelvic rocking exercise of pelvic tilt to relieve back pain and maintain a good posture. You must also do this in moderation.
Thank you so much, Nurse Stephanie, but I still have doubts about what to do on my baby when she goes out, since I'm a first-time mother.
That is why both of you are here, because we are going to teach you what to do in preparation for childbirth.
How can we prepare psychologically?
Mrs. Apa can prepare psychologically by building a strong support system. We should advocate active participation of husband during labor and delivery to serve as a coach, because most mothers feel more encouraged to push when they have their husband with them. On the other hand, fear during pregnancy can lead to tension, while tension can lead to pain, right? So, there must be a technique that removes the mother's fears by the use of abdominal breathing exercises and relaxation technique.
I understand, Nurse Priyan. My husband is my strongest support system these days.
That's great to hear, Ma'am Christine. Have you already decided on the method of delivery and your chosen birthplace?
Yes, I actually plan on giving birth at home because it is where I feel more comfortable. However, I also consider giving birth at Don Vicente Gullias Memorial Center because it's the nearest hospital from our house.
Oh, okay, that's good. Because you are a primi gravida, you are actually required and recommended to give birth at the hospital because it is more safer for you and for the baby. Mr. and Mrs. Apa, I just also would like to remind you to prepare the following prior to giving birth. These are diaper, towel, baby dress, and soap for the baby. And also, you have to decide on who would accompany Mrs. Apa during the delivery. And you also have to secure blood donors just in case there is severe bleeding.
Thank you so much, Nurse Priyan.
You're welcome, Mrs. Apa.
Talking about family planning method, Mr. and Mrs. Apa, there are several types of family method you can use. You can either use LAM, pills, condom, patch, depo, and IUD. So it's up to you what method you would like to use.
I think LAM is best for you. And besides, it's free. What do you think, baby?
Nurse Joy, can you tell us more about that method?
Okay, Miss Apa, LAM or the lactational amenorrhea method, this is actually a process where you're going to breastfeed your baby straight to 6 months. But this is actually temporarily only, so you can use other method. You can use condom or pills. But if your husband or you is allergic to latex, so you can choose pills.
Thank you so much, nurses, for the health teachings. Me and my husband, we will follow all the given instructions.
Yes, thank you so much for all the information. It was really helpful.
You're very welcome, Mr. and Mrs. Apa. We're happy that you learned something from us today.
We are looking to see you again in the next visit.
Yes, good luck and congratulations ahead for the coming.
Prenatal care is important, especially to pregnant mothers at their 3rd trimester, because these measures ensure that the expecting mother and the baby are in good condition for the birth. Prenatal care allows doctors and midwives to identify and treat any potential health problems and complications during the delivery.
Good day everyone, today I'll be talking about the importance of prenatal visit and 3rd trimester. So it is important because the 3rd trimester marks the home stretch as you prepare for the delivery of your baby. So as the fetus continuing to grow in weight and size, the body systems finish maturing.
Prenatal checkup is important because every woman under prenatal care can be more confident about avoiding pregnancy-related complications such as high blood pressure or diabetes. During pregnancy checkups, doctors can also prescribe prenatal vitamins to promote the healthy development of the fetus inside the womb. So during the 3rd trimester, your fetus continues to grow in size and weight. The lungs are still maturing and the fetus begins to position itself head down. And also, the full development of your baby's brain and other vital organs such as lungs, eyes, heart, immune system, intestinal system, and the kidneys takes place in the final term of your pregnancy.
So, why is it important to take a prenatal care checkup during the trimester of the pregnant woman? Because it is really important that a healthy pregnancy, especially the due date of the mother, approaches, and we will schedule it during her 3rd trimester, about 2 to 4 weeks. And depending on your health, pregnancy history, and of course, starting at 36 weeks, you'll need a weekly checkup until you deliver your baby. Pregnancy helps also to catch up potential concerns and early and reduces the risk of pregnancy and birth complications.
That would be all. Thank you.